Hello! Today, I want to talk to you about Project Empower, how we are reimagining the mental health patient experience in Canada. I am Aqil, and I'm a human-centered design research and strategy consultant. I experienced psychosis and was diagnosed with a mental illness 2 years ago. My experience was uncompassionate, and it exposed significant flaws in the system. This is Nicole, my project collaborator and medical expert. We met through the qilart program. She is a psychiatry resident and is passionate about improving patient care. Psychosis can be a terrifying and isolating experience, particularly during a first hospitalization. Let me share Malia's story. She was hearing voices and seeing people who were not there. Concerned neighbors called the police and they barged into her home, restrained her, and took her to the hospital. She was confused, scared, and felt interrogated by staff, leaving her feeling more traumatized. During her month-long stay, Malia is given antipsychotic medication but received minimal holistic support. Overworked staff, lack of personalized care, and no therapeutic activities or counseling sessions, Malia spends most of her time alone with nothing to do. Malia eventually got stable and recognized that she experienced psychosis. However, her discharge was vague, with little guidance on how to access recommended support. Malia struggles to find and connect with support services. Months went by and she was left on her own, leading to her falling through the cracks and get hospitalized again. This experience is sadly common for first-time psychosis patients. Many patients endure traumatic interventions, poor inpatient care, and hard to navigate post-discharge support. In fact, up to 80% of patients relapse within a few years in the first episode. Specialized early intervention services have shown that with the right support, relapse rates can be reduced to as low as 20 to 30%. Clearly, something needs to change. We've engaged folks to reimagine a better journey where patients feel empowered. The big vision, a more compassionate journey for someone experiencing psychosis, from peer-assisted care team during crisis to ongoing connection to community support. The two-step solution we think will reduce relapse rates and improve long-term outcomes: Inspire to Care program and Parting Care Kit. Inspire to Care program is an initiative that provides patients with positive reinforcement and accessible information about their diagnosis. The care components are bite-sized illustrated stories of successful recovery and information about patients' mental illness conditions shared during mealtime. Parting Care Kit is a curated package designed to provide discharged patients and their caregivers with the tools, information, and inspiration needed to navigate the recovery journey after discharge. This kit aims to empower individuals with supports that promote wellness and resilience. This approach has the potential to transform mental health crisis intervention, significantly improving outcomes for individuals experiencing psychosis by breaking the rehospitalization cycle, which in turn reduces the burden of the healthcare system. To break it down, assuming the average cost per psychosis hospitalization is $10K, the total savings for 100 patients can be $1.2 million, and this is a lowball estimate. These figures highlight the substantial financial burden associated with psychiatric hospitalizations. We're seeking funding to bring this project to life. The majority of these funds will be used for the production of materials and distribution of the care kits, ensuring they reach those who need the most. With minimal ongoing costs, this initial investment will have a lasting impact, helping to reduce hospital readmissions, enhance patient and caregiver engagement, and ultimately improve the quality of life for individuals experiencing psychosis. With your support, we can make a real difference in the lives of those affected by psychosis, helping them move from crisis to recovery with dignity and hope. Thank you for considering our project.